Hello everyone, this is Stacey Ann. Over the next few minutes, I will be discussing neurodevelopmental disorders and GI issues and how it affects this special population. First, I will be defining neurodevelopmental disorders. What are neurodevelopmental disorders? According to the Journal of Childhood and Developmental Disorders, a neurodevelopmental disorder is described as a genetic or acquired biological disability in the functioning of the brain that is responsible for the dysfunction in a child's behavior. Who it affects? Children who were born with neurodevelopmental disorders such as cerebral palsy, spina bifida, or inborn errors of metabolism usually suffers from gastrointestinal problems. Some of these include oral motor dysfunction, which leads to feeding difficulties, risk of aspiration, or prolonged feeding times, and malnutrition. Foregut dysmotility can cause several problems such as dysphagia, gastroesophageal reflux disease, and delayed gastric emptying. How it affects the child. It affects the ability to learn, such as mental retardation, dyslexia, cerebral palsy, and autism. It addresses the complexities of the central nervous system development in children. There are four major categories: cognitive dysfunction, behavioral problems, motor dysfunction, and seizures. These neurodevelopmental disorders include physical and functional abnormalities. Gastrointestinal issues in children with ASD, autism spectrum disorder. Even though we know that autism spectrum disorder is characterized by communication impairment, social abnormalities, and stereotypic behaviors, we must be mindful that there is also multiple comorbidities that exist in autistic individuals. One of these include gastrointestinal abnormalities, which are of a major concern. This is due to its prevalence and connection with the severity of core autism behavioral abnormalities. Gastrointestinal issues in children with ASD continues. Due to the many varieties of GI conditions, dietary issues, and enteric immune abnormalities that have been reported in individuals with ASD, it is clear that GI dysfunction contributes to the manifestation and core symptoms of autism. According to Dr. Bradley Ferguson, PhD at the Bond Life Science Center, many children and adolescents with autism often exhibit problem behaviors such as aggression, as well as experience gastrointestinal issues, especially constipation and diarrhea. Recent and various studies have shown the prevalences of GI abnormalities in children or individuals with ASD range from 9 to 91%. Children with ASD often experience GI symptoms such as constipation, diarrhea, abdominal discomforts. Other studies have also found that GI complications can also occur due to environmental risk factors for children with ASD. In addition to GI issues in autistic individuals, many psychiatric illnesses are also linked to GI problems. These include depression and anxiety disorders. It is also estimated that 60% of patients that are suffering from functional functional GI disorders also exhibits morbid major affective disorders. Effects of GI on immune system and brain. Gastrointestinal issues can also affect the brain, immune systems, and behaviors. Several immunological abnormalities have been seen in GI tracts of autistic individuals. These include leukocyte infiltration, complement activation, lymphoid hyperplasia, and pro-inflammatory cytokine response. These findings are consistent with autistic individuals with comorbid GI problems. Please see photo of symptoms of GI issues. Some symptoms of autism may be due to neural and gastrointestinal dysfunction. This is because the autistic individual is often unable to communicate or express GI discomforts or distress. This forms the underlying basis for abnormal clinical representation. Finally, constipation is often a problem that has been overlooked in individuals with neurodevelopmental disorders. Thank you for listening. I hope that you have learned a lot or something from this presentation. Please see references as follows. Thank you.